I'm Dr. Calvin Chow with the Academy of Communication and Healthcare, and I'm here to share 5 quick tips to connect to enhance your virtual communication with patients. The first tip is to be present because this sets us up for success. Preparing ourselves for the encounter may be one of the least acknowledged and maybe one of the most important skills in a patient encounter. It might seem obvious, but imagine when we're having a very rushed day. Lots of patients to see, maybe we're not at our best. We've all had days like that. Now let's think about how we'd approach the next patient on one of those days. The point is that even when we're not feeling our best selves, we can take a moment to recalibrate by quickly addressing our immediate needs. Some possibilities here might include deep breathing out, actively putting our worrying thoughts on hold, taking a bite of a snack, even going to the restroom if you need to. We'll feel better and provide better patient care if we take this moment. One other thing about being in a video visit is that we now have feedback about our nonverbal presence that we normally don't have. This can be distracting, and most of us aren't in love with seeing ourselves on screen. It can be helpful to notice our posture, eye contact, facial expressions, verbal pace, and other nonverbals to enhance our effectiveness. Tip 2 is to identify the patient's needs. Sometimes we might think it's clear what the patient wants, but before we go with that assumption, ask your patient for their entire list of topics they want to talk about. Now, I know you're looking at me like I have 5 heads right now, but remember how frustrated we get when we think we're done with a clinical encounter and the patient says, "Oh, by the way, I have chest pain." If we don't get the list of topics at the very beginning, this happens significantly more often. The third tip is to listen, and I mean really listen. As clinicians, usually we're thinking while patients are talking, we're not fully listening. What's a differential diagnosis? Did I forget to refill that medicine? I don't remember that x-ray. Maybe I should look it up now. Instead, concentrate on both the content and emotion of what the patient is saying. Tip 4 is to respond with empathy. There are 2 kinds of responses, both of which are valuable, and both of which depend on the fact that we need to be listening closely. The first kind of response is to reflect back the content of what we heard. This is where our quiet typing while the patient was speaking can pay off. Summarizing or paraphrasing can be really helpful. For us, sometimes talking through what they said can clarify our thinking. For our patient, hearing their words repeating back to them can help them feel like we've been listening. It's a win-win for both. The second kind of response takes a little more effort, and that is to respond to the emotions that we heard. Patients rarely intersect with us without some kind of emotion. So naming their emotion and using an empathic statement can help our patients feel even more that we've been listening. The 5th tip is to share information and ask for a teach back. You ever get frustrated with patients who don't do what we told them to do? Usually we download a whole bunch of information, including jargon, and sometimes we ask, "Do you have any questions?" at the end. They may be too polite or overwhelmed to ask. If we can use these tips throughout our virtual encounters, we can enhance our clinical thinking, signal that we're really there for our patients, and develop more and more resilience for ourselves along the way. For more about these tips and for some demonstrations, please visit our website, where you'll find some additional resources for virtual communication that we hope will be helpful to you.